Good morning. Today we are going to see a case presentation with drowning. So it is about a 19-year-old female with psychiatric illness who's on medication. She was last seen alive on 11/7/2022 at 9 a.m. and the body was found in a well on the same day at around 3:30 p.m. and the well is about 30 meters away from home. Autopsy is done on the very next day. External examination, we found froth was seen over the nostrils, leaves and twigs were present, bleaching and soaking of the hands were seen. On internal examination, we found the froth in trachea, brain congested edematous, and positive shifting of sign. Lungs was edematous and congested. Cut section shows white color for the fluid. Internal examination, heart was failed, kidney congested, and the cause of death was given as there is nothing to suggest that the disease died due to any other cause other than drowning. And alcohol was also detected in the blood, along with battles. So moving on to the case discussion, 3 lakh annual drowning deaths are seen worldwide. 92% of drowning deaths occur in low and middle income countries. Disproportionately impacts children and young people. Drowning is defined as a form of asphyxia due to aspiration of fluid into air passage by submersion in water or any other fluid medium. Complete submersion is not necessarily. Only immersion of the nose and mouth alone can lead to death, and diagnosis is based on autopsy findings, circumstantial evidence, and scene correlation. The differential diagnosis, froth seen in drowning can be seen in other conditions also, like acute pulmonary edema, strangulation, electric shock, epileptic fit, opium poison, putrefaction. Quantity and persistence of froth are much greater in drowning. Autopsy indicators, fine, white, persistent froth present at mouth and nostril. Froth is seen in airways and lungs. Lungs are voluminous and water-logged. Cadaveric spasm present and positive dietary test. On external examination, you can see wet cloths, wet, cold, clammy skin, postmortem lividity of face, neck, chest. Face is pale, blotted, discolored, eyes half open, dilated, traces of mud and pine vegetations in nostrils and hair, tongue swollen and protruding, and penis and scrotum becomes swollen with emphysema. On external examination, postmortem lividity is usually light pink in color, seen on the face and upper part of the chest. Rigor mortis appears early, especially when violent struggle takes place before death. A white, fine, leathery froth or foam is seen in the mouth and nostril, which is one of the most characteristic external sign of drowning. Other features seen externally are cutis anserina, that is, whose skin becomes glandular and shows puckered appearance because of the contraction of the erector pili muscles. Weeds, gravel, grass, sticks, leaves, and twigs are present in the water. Maybe finally crabs in the hand due to cadaveric spasm. This indicates that the person was alive when he drowned. Soaking of the skin due to absorption of water into its layer. Other name for it is washerwoman's hand, that is cutaneous maceration. And wrinkling of the skin begins to appear shortly after immersion. Bleaching of the epidermis in 4 to 8 hours. And sodden appearance is seen in 20 hours. Internal findings, froth in the airways, lungs becomes markedly voluminous and billowed, ribs impressions prominently visible on the lateral aspect of the lungs, and cut section shows froth and bloodstained fluid. This is the difference between the freshwater and seawater drowning. Freshwater drowning, you see ballooned lungs, color may be pale pink in case of freshwater drowning, uh, and it retains the shape, do not collapse. Um, and crepitus is hot. In seawater, it is balloon but heavy. The color is purplish or bluish, soft jelly-like in consistency, and it does not retain the shape but tends to flatten out, and no crepitus can be heard, and copious fluid both present. On internal examination, you see emphysema aquosum, overinflation of the lungs with water lodging, edema fluids in the lower airways, block passive bronchial collapse that normally occur at death, maintaining lungs in inspiratory position. If victim is unconscious at the time of drowning, mere flooding of the lungs with water, but without formation of columns of froth occurs, also known as edema aquosum. Water in the stomach and intestine can be seen. Water in the middle ear can be present, and congestion of the other viscera. On internal examination, you see Baldorf's hemorrhage, that is, the alveolar walls may rupture due to increased pressure during forced expiration and produces hemorrhage subpleural. And the Baldorf's hemorrhages are shiny, pale pink, or bluish red, and may be minute or 3 to 5 centimeter in diameter. It is seen in 50% of the cases in lower lobes of lungs. The stomach contains water in 70% of the cases. If the chemical composition of the water in the stomach is same as that of the medium of submersion, it is a confirmatory evidence of drowning. It is also possible that the victim might have drunk the same water shortly before death. If water is not found in the stomach, the person might have died from shock, syncope, or was already dead. When a disagreeable liquid which was not swallowed voluntarily by the victim and which corresponds to the drowning medium, example muddy water containing debris, is found in the stomach, it is valuable indication of drowning. In cardiovascular system, the right heart appears dilated and filled with fluid blood. Left heart is comparatively empty with minimal blood. Mechanism: in drowning, blood accumulates in the right side due to pulmonary circulation obstruction. The small intestine may contain water in about 20% of the cases, and this sign is regarded as the positive sign of blood drowning. And with the Whitlow's sign, it depicts three layers, that is, the dilution of the intestinal content shows foamy upper phase, moderate liquid phase, and food particles on the water. Middle layer shows the presence of water and hemorrhage. Hemorrhages in the petrous temporal bone or in the mastoid air cells may be seen. Temporal bone hemorrhages are also seen in death due to hanging or carbon monoxide poisoning. Brain congested, gray matter, softening and loss of gray-white junction. Liver, spleen, and kidneys are congested. The other sign that we see are the Shaftnikov sign, that is the presence of liquid of the drowning medium in the sphenoid sinus, considering as the vital reaction of drowning in non-petrified cases, and can be positive in petrified drowning cases also. So the sequence of events in typical drowning are: initial phase, which lasts for 2 minutes, active phase, which lasts for 2 to 5 minutes, terminal phase, which lasts for 5 to 10 minutes. So initial phase, it is a breath holding upon submersion, increasing hypoxia and hypercapnia, and panic and struggle can be seen in this phase. Whereas in active phase, involuntary respiratory movement overcome voluntary breath holding, aspiration of water into the airways, and laryngospasm is seen. Terminal phase, progressive hypoxia leading to loss of consciousness, aspiration of larger volumes of water, cardiac arrhythmia, cardiac arrest, and death. This is Brodel's dog drowning experiment, which was done. The experimental setup contained dogs were restrained on wooden board with lead weight. Femoral artery cannula was inserted. Pneumograph on epigastrium to check for the respiratory movement, and head maintained 30 centimeter below the water surface. Stages seen were stage 1 was surprise phase, which lasted for 5 to 10 seconds, and 1 to 2 breaths and minimal activity was seen. First respiratory arrest, which was around 1 minute, violent struggling and mouth shut and attempts to surface were made. And deep respiration, which also lasted for 1 minute. Deep inspiration, white foam expel, and agitations could be seen. Stage 4 was second respiratory movement, no thoracic movement, corneal reflex lost, and pupils dilated. And terminal gaps, that is 3 to 4 final breaths, fibrillary contractions in lips and jaws. And total duration was around 3.5 to 4 minutes, and seawater approximately twice as lethal as freshwater. So the pathophysiology of drowning. Drowning is a mixture of both mechanical presence of water within the respiratory system and fluid electrolyte changes which vary according to the medium. Seawater, it is different than the freshwater in which the immersion has occurred. So the types of drowning that we know are typical, that is freshwater and saltwater, and atypical, that is dry drowning, immersion syndrome, submersion of unconsciousness, and near drowning. Wet drowning, water is inhaled into the lungs and the victim has severe chest pain, also known as primary drowning, in which death occurs within minutes of submersion, secondary to cardiac arrest or VFib. In freshwater drowning, large volumes of water cross the alveolar membrane and enter the circulation, leading to hypervolemia. And then hemolysis of the RBCs occurs, leading to hyperkalemia and ventricular fibrillation. And hyperkalemia finally leads to ventricular fibrillation. Death occurs in 4 to 5 minutes, whereas in salt water, due to increased tonicity of the water, fluid pass through the systemic circulation into the lungs, and here we observe hypovolemia in contrast to freshwater, where we saw hypervolemia. Here hypernatremia is seen. In freshwater, we see hyperkalemia. In salt water, the death is delayed. It occurs in 8 to 10 minutes, whereas in freshwater, it occurs in 4 to 5 minutes. If you see the sequence, in freshwater drowning, the water is first inhaled into the respiratory tract. Water is absorbed into circulation, resulting in gross hemodilution. Massive increase in blood volume leads to bursting of the RBCs and there becomes electrolyte imbalance. Hyperkalemia is seen, which ultimately leads to ventricular fibrillation. Whereas in seawater drowning, as already discussed, due to increased tonicity, fluid is drawn into the alveolar spaces. And here hemoconcentration occurs in the pulmonary circulation. And hemoconcentration causes crenation of RBCs and myocardial anoxia. Next is the dry drowning. Water does not enter the lungs, but death occurs from immediate sustained laryngeal spasm. Thick mucus foam and froth may develop, producing a plug. 20% of the cases of immersion and is commonly seen in children and adults under the influence. Next, we have the immersion syndrome. It is also known as hydrofusion or submersion inhibition. Death results from cardiac arrest due to vagal inhibition. It is triggered by cold water stimulating the nerves ending of the surface of the body, water striking the epigastrium, cold water entering the ear, drums, nasal passage. Also occurs from wrong diving technique. Submersion of the unconsciousness. That means the person was already unconscious before he was thrown into the water body. It can be due to either myocardial infarction, head injury, or epileptic fit, and the person falls into the water. And so they'll be absent or minimal signs of drowning. Now we have secondary drowning. It is also known as post immersion syndrome or near drowning. It refers to submersion victim who is resuscitated and survives for more than 24 hours. Victim may survive or die later, and death occurs due to pulmonary edema, aspiration pneumonia, and electrolyte imbalance. Long-term morbidity and also CNS injury can be seen in cases of secondary drowning. So the test for drowning, we have the Jetler test, which is based on the chloride content in the left and the right side of the heart. Then we have the plasma specific gravity, where the serum magnesium content, diatom test, and drowning index. So the diatom test. What is diatom? These are the microscopic unicellular or colonial algae with siliceous walls belongs to the class Bacilliaceae. Demonstration of diatoms in postmortem tissues microscopically suggests death due to drowning. Present in virtually all aquatic environments, freshwater and marine. Diatoms measuring 60 microns in diameter are said to enter the pulmonary circulation during drowning. So diatoms they vary from place to place, and seasonal variation can be seen in some places. And these are of different shapes, as you can see in the diagram. Next is the methodology to do diatom test. Sample digestion occurs by strong acid like nitric acid, sulfuric acid, and filtration or removal of the organic material is done, and microscopic examination then of these minute algae are done under light microscopy, and detection of at least 5 diatoms per 100 gram of sediment from the viscera other than lung is considered reliable, and species identification, that is comparison with the reference water sample. A positive diatom test interpretation: diatoms present in at least 2 to 3 closed organs like brain, liver, kidney, and bone marrow. Quantitative threshold mean, that is more than 5 diatoms per 110 gram tissue in organs other than lungs. Qualitative and quantitative correspondence between extracted diatom and those in reference water body. A species match between body and drowning medium. And lung to drowning medium ratios above 2 are seen as safe indicators of drowning, as higher diatom concentration in lungs than in drowning medium can only be explained by active water aspiration. False positive diatoms in bone marrow of non-drowned bodies can be detected with rates in same ranges as drowning cases. Environmental contamination during autopsy can occur, which can also lead to false positive diatom test. Diatoms in organs from chronic exposure to the same drinking water or inhalation of dust. Laboratory contamination can also lead to false positive diatom test. We have now drowning index. Distinguish death by drowning from any other causes. Parameters: weight of the left and right lungs in gram, weight of the pleural fluids in grams, and weight of spleen in grams. So the drowning index is weight of lungs plus weight of the pleural fluid divided by the weight of spleen. The higher the index, the greater the risk that death occurred due to drowning. One study done by Sumivoro et al. Used drowning index more than equal to 14.1 for patients recovered within 2 weeks of death. So the limitation, the presence of splenomegaly would lower the ratio. The spleen weight tended to be higher in patients with cardiac death. These are the recent advances you see in cases of drowning. So the toxicological analysis in drowning, xenobiotics are frequently involved in drowning cases. Alcohol, most common contributing factor. Sedatives can also act as a contributing factor. Recreational drugs like amphetamine and cannabis also play a major role. Antidepressant and anti-epileptics are other contributing factors leading to the death of the person. So toxicological analysis in drowning, alcohol impairs judgment, coordination, and swimming, may contribute to hypothermia. Drugs and medication can cause loss of consciousness and may impair response to aquatic emergencies. Multiple blood sources like cardiac and femoral are chosen. Vitreous humor, more stable and less prone to postmortem changes. Urine can also be used for drug screening. Admission samples, if near drowning case is there, then you can take the cardiac blood, peripheral blood, vitreous humor, urine, gastric content, liver and kidney samples. On histopathology of drowning cases, in lungs you see marked alveolar edema, dilated alveolar spaces, and emphysema aqueous changes. Heart shows mild interstitial edema, congestion of the vessels, and brain shows cerebral edema, congestion and swelling of the capillary endothelium. So these are some of the histological pictures, that is, it images changes of the lungs in drowning death. Second picture shows dilatation and rupture of the alveoli, whereas the third picture shows the complete distortion of the alveolar architecture with hemorrhage. Other biochemical analysis that can be done are levels of strontium can also be tested in seawater and freshwater. Interpretation of strontium level in blood is useful in diagnosis of seawater drowning. It does not play a significant role in freshwater drowning. Measures the difference between the left and the right ventricular blood strontium level. Also, other electrolytes measurement like sodium chloride and magnesium can also be done. Aquaporin 5, which is a water channel protein expression in lungs and kidneys, may help to differentiate freshwater and saltwater drowning. So the causes of death in drowning are asphyxia, circulatory and respiratory failure, ventricular fibrillation, and laryngeal spasm. Vagal inhibition, that is ice cold water, exhaustion, injuries of the skull and dislocation of the cervical vertebra, and late complications. So the signs that we see in antemortem drowning are froth, cadaveric spasm, edema aquosum, water in the middle ear, GI tract and postdatum dust. Manner of death, that is accidental drowning. It commonly occurs in children and elderly individuals and person who cannot swim. Death in the domestic bath, that is a sudden collapse from coronary or cerebrovascular disease, may loss of may occur because of loss of consciousness, leading to emotion of the head and death. Epilepsy or fall producing head injury may also cause death. Whereas in cases of suicidal drowning, you will have a psychiatric history, suicidal note, hands and feet bound, and history of previous attempts. It is most commonly seen in females, and drowning in India is a common method of committing suicide, especially among women, and more particularly in localities near the sea or river. In such cases, the body is usually full dressed, and suicides usually remove some of their outer clothing and shoes before leaping into the water body. In homicidal drowning, if it occurs, will be associated with findings like injuries or poison, and death occurring in shallow water should be considered as homicidal unless otherwise proven, and the hands and feet of the victim may be tied with weights. Signs of struggle or marks of violence on the body may be found. So, the circumstances of the drowning, that is, bodies recovered from water may have died due to natural diseases, injuries before or while in water, hypothermia, and drowning. So, the autopsy finding must be correlated with scene and history. So, the water temperature, like environmental factors, also play a major role. Cold water less than 15 degrees Celsius slower the decomposition and protective in near drowning, whereas in warm water, more than 20 degrees Celsius, rapid decomposition and accelerated skin changes are seen. Postmortem artifacts can also be seen, like those shown on the picture, and these could be due to animal predation or plant material adherent to the body or due to any dragging injury while trying to put the body into the water body, which are usually prominent in the hands, knees, and forehead. So the conclusion, drowning is a diagnosis of exclusion. Most finding indicate submersion rather than drowning per se. Some of the signs are most applicable in cases of putrefaction. Thus, in the absence of any other cause of death, and supported by the circumstantial and autopsy finding, it is appropriate to conclude. I am of the opinion that there is nothing to suggest that the disease died due to any other cause other than drowning. These are the references, and thank you very much. Hope you enjoyed this case presentation.